to this video. My name is Anushka Gandhi and today I'm going to give you a brief overview of how an emergency department here at a hospital in Canada would look like. Now, ER, which is an emergency department, is something which you need to approach in some kind of emergency. Now, if you have some severe pain or if you meet with an accident or something which needs an immediate care, you need to approach the ER department here. Now, last year around this time, I was seen at the ER with some emergency, and this video is going to be based upon my experience and also step-by-step description of what you can expect at an ER, at an emergency department in Canada. Now, this is going to be based upon Ontario's hospital, so it's strictly restricted to the Ontario province of Canada. Okay, so once you approach the emergency department at any hospital here in Ontario, the first thing you need to do is to get yourself registered at the front desk. Now, I still remember my experience wherein I was supposed to give my identity proof and I had to fill up a form. Now, once you're registered, the next thing they'll ask you to do is to wait in the waiting area. Now, from my experience, I remember it was all crowded. There was no place to sit, but eventually I got a place to sit after a while, and I probably think it was due to the peak hours. I went there during the afternoon, so it was kind of busy there. So after you wait there, the second step is the triage room. At the triage room, there will be a registered nurse who would do a brief assessment of you, who would do your vitals there, who would ask you what your signs and symptoms are, who would also assign you with an urgency level. Now, that's where they know how much or when to take you in or how much of an emergency your situation could be. So based on their assessment, they will decide when to take you in the treatment place. Okay, so your urgency level will decide how much wait time would you need to deal with. For example, if your situation is better than someone else in pain, they would probably give a priority to that person even though he might have arrived after you. So based on your urgency level, you will still have to sit at near the waiting area and wait for your turn to come. So soon after that, while you're waiting in the waiting area, you would again be called at a registration desk. Now, this is going to be a different registration area wherein you're supposed to give all your insurance details, or if you have your health card, you're supposed to give your health card details there. If you have a health insurance, you're supposed to give your insurance. If you have your school insurance, so whatsoever, they just need to know your mode of payment for the entire treatment. So you need to give that to them beforehand before you get into the treatment space. So I want to quickly put it out there. Back in the time when I was seen at the ER, I had my school insurance. So if you are studying here, if you are a student in Canada, do not freak out. Just give your school insurance, just give your health benefits. If you do not have that handy, just call your college, just call your university and get those details. They're often put up there on their websites, on the college or university website, so you could anytime go back and access. Give it to the registration desk and they will then deal as to what and how much you would have to pay. Okay, so after all of this is done, you'll be taken to the treatment space. Now, this space is going to be wherein you would see all kind of patients sitting there, waiting there. You would see the general wards, you would see the ICU, you would also see the diagnostic rooms, all physicians, the specialists, nurse practitioners, all kind of staff within the treatment space. Now, this is where you would be appointed with a physician, and the physician will approach you, will ask you all kind of questions related to your health, your illness, and that's when they would decide to do some diagnostic procedures for you, meaning they would ask you to get some lab work done, some radiographic diagnosis done, and now you would be shifted to the diagnostic area. So you'll be taken to the diagnostic area wherein all kind of lab work will be done for you, whatever the physician thinks is necessary for you. In my case, I had to go literally all over. I got my blood work done, I got my chest x-ray, I got my sonography, I got my ECG done. So it was like a whole lot of things to do for myself. But again, it depends. Usually this is a general procedure, so they do all these common things for everyone out there, irrespective of your illness and your intensity of pain. So this is how it works. You're supposed to go to the diagnostic area, get it all done, and then wait until the result arrives. Okay, so after you have your lab reports handy, which you would not have in your hand, but the physician will directly get from the diagnostics, that's when the physician will approach you and do a thorough evaluation based on your clinical, radiographic and pathological diagnosis. That's when they'll decide if they need to admit you in some of their wards, or if they will have to just discharge you with some medications by prescribing some medications. So that's when they decide what's your plan of treatment. Now, you might also need an evaluation done by the specialist if you've got some serious issues, or if you've got some serious concerns, or if the physician is not able to or wants to involve a specialist in your case. So in that case, you'll just have to wait again in the waiting area or in the treatment space, wherein the physician and the specialist, both of them, would approach you and would do further diagnosis or would further evaluate and plan a treatment for you. Now, in terms of the treatment plan, there could be two options. Option number one is they'll admit you, they'll hospitalize you in some general ward or an ICU depending on your illness. Or the option two is they'll just discharge you by giving you a symptomatic relief. For example, if you have pain, they'll just give you a symptomatic relief. In my case, I had some pain, so they gave me an IV, and after a couple of hours, I was fine and I was discharged. So either they could just give you a symptomatic relief and prescribe you with the medications which you might need for a few days, or they'll admit you. So this is how an ER would look like. So after you're shifted to a ward, that's when you are an inpatient of the hospital. So your emergency room journey is now ended and now you're an inpatient. If you're discharged, again, your emergency room journey is ended and now you're an outpatient, so you're not a patient anymore. So this is how more or less an emergency room experience could turn out to be for you if that's going to be for the first time. Again, this is based on my personal experience. I might have missed something, or I might have spoken a little more about something, but again, it's based on my experience. This is how things happened in my case. Now, one last thing which I would like to mention is that all of this might sound very quick, very systematic and very easy to do, but trust me, it is systematic, it is easy to do, but it's not very quick. The wait time here in Canada, especially in Ontario, especially in big cities like Toronto, are very huge. So all of this, in my experience, in my case, it took almost 7 to 9 hours for me to get into the ER and to get out of an ER. So all of this process took almost 7 to 9 hours for me, and those 7 to 9 hours were really difficult and tough for me. So when you approach an ER, you need to make sure that you have enough time handy, because trust me, it's not going to be quick given the amount of crowd, the amount of people the healthcare system here is taking care of. But the last thing I would like to mention is the healthcare workers here in Canada are giving all their flesh and blood in order to cure patients, especially in the COVID pandemic. So it's really worth all the wait. Trust the process, trust the healthcare system here. Everything will be fine. They're doing their best to take care of you. So yeah, so I think we should put all the negativity outside and just trust the healthcare workers here. With that, I would like to end this video. If you find this informative, please consider to subscribe to my channel, hit the like button, comment down below what you want to watch next, and until then, take care. Bye.